Hello, this is how to do your 90-90 lifts. Now, prerequisite for this is you have to be comfortable in this 90-90 position where both my legs are comfortably on the ground. This inside knee of my back leg is on the ground. This foot's here. I'm not fighting for my life or still modifying where I'm back here. If that's where you are, or even if that's where you are today, then feel free to just go to the alternate exercise, regress it back, and just work on getting that hip mobility in. But if you feel all good, you can get into this position. It's comfy, you're not fighting for your life, then we'll go ahead and get into it. So for this guy, we're gonna be doing some lifts, which is gonna work a lot of the little tiny hip stabilizer muscles that do not get worked very often. So these look pretty simple, but they are actually very hard. A couple things I want you to keep in mind is don't push yourself into a place where there's pain and you're just trying to follow along and do the exact thing that I'm doing and it hurts and it's stabby and it sucks. Don't do that. You're gonna hurt yourself, you're not gonna improve. We just need to meet ourselves where we are. So you might find that you can only do one variation. That's great. Sit there, stay there, work on increasing that strength in your hip stabilizers, and then when you're ready, you will eventually be able to move on. If you try and run face first into the wall right out of the gate, you're not gonna get anywhere. It's gonna suck and you're not gonna have a good time. So as I demo this, go ahead and follow along with me. And if you think that if you realize that you aren't able to do one, go ahead and skip it and stay with the one that you can do. All right, so we have variation number one. We're just gonna start from this 90-90 position, lifting our knee. And it's easy to think lift your knee and it comes from your hip and your upper body. Don't do that. You're gonna keep your hip and your upper body nice and stable. I like to have my hand on my hip so I can actually feel those hip muscles contracting. Pick my knee up and put it down. Pick my knee up and put it down. If this needs to be easier, you can take yourself away from that knee and lean down toward the ground so you're more like this. Basically, the farther this way your body is, the easier it's gonna be. The closer to upright you are, the harder it's gonna be. So if you're in this position, it feels great, awesome. If you need to change it, feel free. All right, so that's knee lifts number one. We'll do those on both sides, but for now I'm just gonna demo on one. Now we're gonna get into lifting our foot. Before we get right into that, we are gonna just start by kind of rocking and rolling the toes and the heels. This might be enough for you. This might be where we stay. And I want you to think about this as not happening at the knee, but happening at the hip, because we're controlling the pivot from those muscles in our hip. If you put your hand on your hip, you might actually be able to feel that, which is always kind of fun. And then if this feels good, you're gonna try and pick your foot up. You're not gonna get very high. You might get a little higher than me. I don't have a ton of hip internal rotation just because of how I'm put together. But the height doesn't matter at all. What matters is that these hip muscles contract and they're not spasming or cramping or making you feel like you want to die. Similarly, you can lean away from it to make it a little bit easier. Usually a little bit more forward, so now I'm more forward over this knee will make it a little easier for you. Then you can slowly progress to being upright. Obviously you do both sides, and you might find that one side is a lot more comfortable than the other. That's fine, that's normal. Just meet yourself wherever you are on whichever side. It will improve over time if you keep showing up, so keep showing up. Ask me if you have questions and I'll talk to you soon.